My name is Bill. I'm the program director at the Family Support Center here in Hastings. I replaced Karen Jousma after she retired. I've worked in nonprofits for all of my career from the mid 1980s until now, and enjoy helping people learn about protecting kids. Rebecca, do you want to introduce yourself?
Absolutely. My name is Rebecca Warner. I am a CPS supervisor in Berry County. I have been working in child welfare and CPS and foster care for 15 years, and I've been doing this training with the Family Support Center for 10.
Well, as we begin, if you could maybe mute your audio feed unless you have a question. And if you have your video feed on, that would be great, so we can see that you're here with us. You should have received a packet of information which included the paper guide for mandated reporter manual, a handout about shaken baby syndrome, abusive head trauma, and then another handout about reporting abuse online. So there should have been those three items plus a half-page survey that we would like back sometime after the training. We'd like to start out with statistics about child abuse and neglect. And as you can see on the screen or on page 5 in your manual, in 2020, there were 1,526 children involved in complaints investigated by Child Protective Services here in Berry County. Of those complaints, 134 children were found to be victims of abuse and neglect, and 28 children here in Berry County were placed in out-of-home care. It's a major problem here in Berry County, in Michigan, and in the United States. If you look at the United States statistics in 2019, there were over almost 8 million children part of complaints to Child Protective Services, 8 million children. And 91% of those victims are maltreated by one or both parents, and estimated 656 children were victims of child abuse and neglect. That's a lot of neglect and abuse. The federal government put into a law the Child Abuse Prevention and Treatment Act, and the act basically said that each state had to define child abuse and neglect in state law. Michigan did that in 1975, and they identified specific groups of people who were required to report suspected abuse or neglect, and that's called mandated reporters. And that's in Public Act 238 of 1975. And Section 3 really lays out what that is. It lays out the process for you to report to the state of suspected abuse or neglect, but it also lays out who is a mandated reporter. So the rules really are, if you're a mandated reporter, you need to report the incident within 72 hours. Within 72 hours of an oral report, which you need to do immediately, you have to file a paper report. And you need to notify the agency you work for. So in this case, you need to notify the church. And that person who reports the abuse or neglect claim is protected under whistleblower. And of course, if you fail to do it, there's a possibility of a fine or criminal charges and time in jail for you if you fail to report. Page 7 in your manual has a list of people or positions, professions that are required to report under the law. And you can see that there's the typical ones you would think of: physicians, nurses, members of the clergy, counselors, but it also covers childcare providers, licensed childcare providers, employees of organizations or entities that are prohibited from reporting in absence of state mandate or court order, persons employed in professional capacity at any office in the front of the court. So there's a whole list. And if you look at that list, typically you can find somewhere where you would kind of fit into one of those categories. So as a mandated reporter, you have to make that immediate verbal report. And once again, this is just suspecting that somebody is, a child is being mistreated or neglected. You need to call that 855-444-3911 number and report it. And then follow up with a written DHS 3200 form, which you can fax to DHS, and the fax numbers are on the form. One of the things that can make that a little quicker is to report it online. And you would do that immediately, and that takes care of your oral report and the written report. So you would not have to do both of them if you're doing the online reporting. The report form is broken down into a number of different categories. The most current report form is revised in 2018. They will accept older report forms, though, but the newest one is 2018, and a copy of that is in your manual. You can see that at the top of the page was the complaint phoned into Michigan Department of Health and Human Services. And you check either yes or no. And when you phone it in, they will give you an intake number. And you need to keep that intake number, make sure it's on this report form, and keep it, because when you're notified about the progress of the complaint, it will not have the child's name or your name on it. It'll just have that intake number. So that's important to remember. You can see that it's basic information: the name of the children, their birth date, social security number, sex, race. If you don't have all that information, that's fine. Fill out as much as you have. The mother's name with all their demographic information, the father's name, the address of the children, the name of the person that's hurting or neglecting the children, and that person's relationship to the children, and also other persons the children are living with when the abuse occurred, the address, and then a brief description of the injury, conditions, or your reason for suspicion of abuse or neglect. One of the good things before you make your oral report, you may want to do it backwards and fill out this written report, because they're going to ask you the same questions in that oral report. So if you are calling it in, I would suggest that you fill out the form first so you have as much information as you can. The second part of the front page of the report has the source of complaint. And those are the mandated reporter categories. And you can see that it looks like it goes from 01 to 56. All the numbers aren't there, but you can see that it has social workers, court personnel, the physicians, and so on there. And what you would do is put that reporter code down next to your name. You can see that on the bottom of the form, there's room for 5 different staff to report on the same form. And the only way you could really do that is if the child came out about the incident to 5 people. Let's say they indicated this is what happened, and there were 5 adults in the room. Those 5 adults could sign off on the same report. If that same child told 5 adults separately, then each adult would have to do the DHS 3200. You couldn't do it on the same form. And the back page of that is really for medical personnel. If there's injury, they would fill out that part of it. And you really don't have to worry about that back page. It's the front page that you need to fill out. Any questions about the form? If not, Rebecca?
All right, good morning, everyone. So we're going to talk about other considerations. Excuse me. Filing a report can be very stressful. So it is good to have that form filled out ahead of time in case you get a little nervous so the information is in front of you. But you also might wonder, like, am I doing the right thing? Is this what I should be doing? So as a mandated reporter, it is your choice whether you tell your identity to the family. So for example, in my job over the years, something has occurred with the family while I'm working with them, and I am upfront and honest with them and tell them I'm going to have to make a new complaint about this, but that's what I do for a living. So it's a little easier for me. Others might still struggle with it, even though you're a mandated reporter. But even though you're a mandated reporter, your identity is always confidential. So that is up to you and how you want to approach that with the family. CPS will never give away your identity, but sometimes the kids only have contact with so many people, and it's easy for the parents to figure it out. So that is up to you how you choose to go about that. So you can tell them that you're required by law. You can reassure them that they are not a bad parent or that you're accusing them of doing something wrong, just that concerns have to be reported, and that you just want to make sure their child is safe. And filing a report isn't always a bad thing. As Bill mentioned in the statistics, only 28 children in Berry County were removed from their parents last year. That is a very small number, believe it or not. We are not quick to remove children from parents in Berry County. We make sure we give them as much support as we can because we know the best place for kids is with their family. So by filing that report, sometimes doesn't rise to the level of abuse or neglect, but the family needs additional services, and we have the means to connect them with those, and we can get them the help that they need. I think that's all for that slide. So some helpful hints, as we already kind of said a couple times, be prepared when you're calling. The best guarantee is to have that form filled out ahead of time. They will ask you a lot of questions if you call into centralized intake. They're going to ask you so many questions, and you're going to wonder, man, should I have been asking more questions of the child or the parents? And no, you don't. They are required to ask those questions, but if you don't know the answer, it is perfectly acceptable for you to say, I don't know. Don't ever feel like you didn't do enough. As a mandated reporter, you get to consider the source of your information. So if you hear directly concerns of abuse or neglect directly from someone who lives in the home, you are required to report that. That is required by law. If you hear something second, third, fourth hand from somebody, if a friend comes to you and says, well, my neighbor's boyfriend's son did this, you get to decide if you have enough information and if the source is credible enough for you to make that call. So you are only required to call in what someone inside the home tells you. At the end, Bill already mentioned, but at the end of so you'll call to centralized intake or you'll make your online report. CI decides if it meets the law for what is child abuse and neglect in Michigan. And if it does, then it will get assigned to whatever county the children reside in. At that point, the CPS worker has 30 days to complete an investigation. And at the end of that 30 days, we send a letter to mandated reporters or anyone who requests a letter that they get to know the results of the case. And you don't get to know the nitty-gritty details. It's just, did we find a preponderance of evidence of abuse or neglect, or did we not? And that letter will only have that intake ID number on it. So that is why it's a good idea to write that down. Some agencies have a filing process for that, where if a member of their team makes a report, they have a file that they put that in. And then when the results come back, you can file those two together and match them up. If through the course of that investigation, you feel like CPS didn't do enough, or you don't understand why something wasn't looked into better, or you just don't agree with the process of it, or you think something was done incorrectly, under check and balance, there's an 877 hotline number that you are welcome to call and express your concerns. Lastly, it's important to remember that you're not a detective. That's not your role. Your role is simply to determine if the information provided to you is suspicious of abuse or neglect. And the investigator, it's their job to do the digging and figure that out if it is abuse or neglect. So a few additional points that we want to make is that if a child is in immediate danger, the best first call is to 911 and then CPS. CPS is not an immediate response agency, so the best bet is to call 911. A good example of this is if, let's say you're running like a child care for the church or a youth group, and dad comes to pick the kids up and he appears intoxicated. That is a call to 911 and then a call to CPS. Domestic violence is something we take very seriously. And even if the children aren't involved in the domestic violence, it has a great impact on them. So if you know of domestic violence happening in a home, that is best to call CPS as well. And then lastly, one thing we like to go over is human trafficking. And a lot of people think that human trafficking only happens in places like Detroit or Chicago or Flint, but it happens here in Berry County as well, unfortunately. So we like to go over this a little bit. Some signs of human trafficking are if children have STDs, PTSD, if they appear malnourished and hungry, any signs of physical or sexual abuse, or physical restraint, confinement, or torture. The biggest things that we see is that these children are often controlled by unrelated adults. So they're often living with adults that they have no relation to, and their family has no relation to. And it's usually several adults that they're living with. And then a big thing that we have found through the course of our work is that the child often doesn't know these people's real names. They often have nicknames for them. And then they also usually have multiple cell phones. You know, if you have a kiddo that has like 3 or 4 cell phones on them, that's a red flag that something might be going on. The kiddos that end up in this are usually also kiddos that maybe don't feel like they get the love and the support that they need at home. And then these traffickers make them feel loved and supported, and they give them, you know, they take them to get their hair done, their nails done, they buy them fancy clothes, they give them all these phones, and to them, that's what makes them feel loved. And so they don't realize anything is wrong with that. So just something to watch out for and keep in the back of your mind. So the next few pages 12, 13, and 14, go over signs of abuse or neglect. We're not going to go over these in great detail, but I'm just going to hit on a couple things. So physical abuse, I'd like to talk about a little bit, because I think a big misconception nowadays is that children or parents aren't allowed to spank their kids. Parents are allowed to physically discipline their children. It is not considered abuse until it leaves a mark. So a bruise, a welt, a red mark that has to last for a significant period of time. So usually what we tell our staff is like 24 hours. If there's a red mark the next day still, which then ends up being more like a welt, then that would be considered abuse. Burns that are unexplainable, from cigarettes or hot water, fractures or dislocations, head injuries, bloody noses. Those are the things that classify abuse, physical abuse. So I just wanted to hit on that a little bit. Physical neglect is the parent not providing for the child's basic needs. So if they're homeless, living in a car, if they don't have any food that's not related to poverty, I want to make that classification. So, when we have homeless families, we try to connect them to resources that can get them, into a shelter or something like that, and then evaluate why they're in that position. If it's because of drugs or alcohol, that's one thing. But if it's simple poverty, then we try to help them through that. And we don't find that to be neglectful. Lack of supervision is another one. We classify it as improper supervision. And these are typically classified cases like a 2-year-old is found wandering on the street, or, a 4 and 5-year-old are being left home alone. And improper supervision also kind of holds like substance abuse and domestic violence in there as well. And then lastly, sexual abuse. These ones can sometimes be a little harder to prove unless a child outright tells you that something's happening to them. But there are some indicators up on the screen as well. Some things that CPS does not investigate. We do not investigate truancy and runaways. Head lice on its own. I make that caveat because sometimes head lice will be a part of allegations, but there's usually other physical neglect signs, like the children being dirty or having feces under their nails, not just head lice on its own. Medications such as psychotropics, so medications like Ritalin, Adderall, those are a parent's choice. They are not required to put their kids on medication. So if a parent takes their child off of that against the doctor's decision, that's not something we investigate. That is their choice. Refusing immunizations, and then SIV-on-SIV violence. This comes with a caveat though. So there are times, the typical, my brother hit me and my mom didn't do anything about it. That's not something we're going to investigate. But if a child has a criminal conviction against one of their siblings and there's a plan in place for them not to be alone together, or the family is going against that safety plan in any way, that would be considered failure to protect by the parents, because they're failing to protect their child from another person harming them. So unfortunately, we do have situations where siblings might sexually perpetrate each other, but the parent is still required to provide for both of those kids. So if the parents are then leaving them home alone together or not supervising them, that is something that we would investigate. We've had cases in the past where a sibling has physically abused another sibling, broken their arm, and if the family doesn't follow that safety plan, then that's considered abuse or neglect. And then one other thing I wanted to mention is the Michigan Safe Delivery Act. So the Michigan Safe Delivery Act is when a parent has a baby, an infant, and in the first 72 hours, they can drop that infant off at a fire department, a police station, a hospital, and surrender that baby to go be adopted. Those are things CPS does not investigate unless there's signs of abuse or neglect to that child. So if that child shows up at a hospital with bruises all over him, then we would investigate that. But if nothing appears to be wrong and the child is just dropped off, that child will go directly into an adoption agency for adoption. Any questions about any of that?
No? Shaken baby syndrome is abusive head trauma. Of course, it's a serious form of child abuse, and the 50% of the perpetrators, the people who do it, are one or both of the natural parents. Children under the age of 1 account for 44% of child abuse fatalities, and typically that's abusive head trauma. You can see all the consequences and in the signs of shaken baby syndrome. If you would like more training or like some information about purple crying, between the age of newborn and 5 months, babies cry inconsolably, and we have some training material. If you have new parents in your house, in your church, we can get them some training materials. Typically, if they have the birth at Pennock Spectrum, they receive that information already. We hand one out to every new family at the birthing center, but it is something that we have available at the Family Support Center. So when you're responding to these disclosures that the children make, there's some things that you have to remind yourself about taking care of them and then about taking care of yourself. Do remember to underreact. Don't freak out and run outside of the room. Be a listening ear. Be calm and react appropriately. Do believe the child. The child is disclosing this to you, and that's tough for them to do. So it's the right thing to believe them and take them at their word. Reassure the child. Help the child relieve any guilt that they might have. They've probably been blamed their whole life about it's their fault. So help them relieve some of that guilt. And please don't tell them, why didn't you tell me sooner? They're coming forth with this disclosure now. Let's handle it and get them some help and not worry about why they didn't tell you sooner. How to take care of yourself. Work within any church protocols that might be there. But remember, if you are a mandatory reporter, you have to report it. You can't use an agency or a church protocol or procedure to say, oh, I'm not going to report it. Legally, you have to report any suspicion of child abuse. Be prepared. Make sure you know where the forms are, what the telephone number to report it is. If you're online, make sure that you know what your login and your password are and what the website is. Remember, disclosure is a good thing. We want kids to talk. Share your concerns and feelings with others, your peers, the minister at the church. Use stress management tools that you might have. And remember, be clear about your role. You're a reporter and not an investigator. Make sure that you acknowledge your feelings. That's one of the good things about talking about it with peers, with the minister, and then stay focused on the child and their feelings. It's really now not about us, it's about them. Rebecca?
All right, so on the top of page 17, we just review again the reporting protocol and legal considerations. Most agencies have their own policy on how to handle these, but as Bill just said, just a friendly reminder, if you hear the information, you are required to report it. Follow your agency plan, but also keep that in the back of your mind. When to report, when a child or family member discloses, and when you have reasonable cause to suspect abuse and neglect. And then the number is there for you again, and the online portal for you to submit your report that way. So what happens after you make a report? The information gets sent to centralized intake is who takes that information. Nowadays with COVID, those people are spread all over the state of Michigan because everyone is still working from home. So they will evaluate the information, see if it applies, the state laws apply. And if it does, then it will be sent to the local county. Children's Protective Services is required to take 30 days to investigate that report. Part of that investigation involves interviewing the children in the home, all the children in the home, any adult in the home, and then any other parents or people that may have additional information. Part of those people that may have additional information, depending on the allegations, might be the school, or it might be a doctor's office, or a dentist's office, or other providers, agency providers, counselors, therapists, psychologists. So we talk to as many people as we can to evaluate if abuse or neglect occurred or not. During that time, we kind of look at the family as a whole unit as well. And if there are things they need, then we help secure those for them also. One important piece of information that I think a lot of people don't realize is CPS participation by a family is voluntary. They do not have to participate with us. They do not have to cooperate. So while we don't have that issue very much in Berry County, we usually can get a level of participation to be able to address any abuse or neglect that's going on. But to help CPS with that, given that, there is a state law that allows for CPS to interview children at school without a parent's permission. So we try to do those as much as we can and as safe as we can, so we can at least hear what the child has to say. At the end of that 30 days, the caseworker has to decide if there's 51% of the evidence that says abuse or neglect occurred. If there is 51 or over, then the case is opened. If there is less than that, then the case is denied. There are 5 categories for openings or denials. Category 5 and 4 at the top there, those is where there's not a preponderance of evidence of abuse or neglect. Number 5 is, category 5 is like if we get a complaint of a dirty home and we walk in there unannounced that same day and it's like pristine clean and like just there's no way that that ever happened. So those are pretty rare, because usually in allegations of abuse or neglect, there's some level of accuracy to them. It may not rise to abuse or neglect, but there still might be issues going on. So those we categorize as category 4 case, where abuse or neglect is not confirmed, but maybe that they need some help with other things in their home. Category 3, 2, and 1 is when there is a preponderance of evidence. And the categorization of that case is decided based on a risk assessment tool that the state of Michigan uses. So that risk assessment determines current and future risk to the child, depending on lots of different factors in that family's life. So a category 3 case would be a low or moderate risk, and we would refer the family to services. That case is going to stay open for roughly 90 days to help connect that family with those services and reduce the risk in the home. A category 2 case is a high or intensive risk level in the home, and that case can last anywhere from 180 days to sometimes 2 years or so to get the family the services they need to rectify the conditions in the home and keep the kids safe. Category 1 case is where there's a preponderance of evidence, but due to the allegations and the severity of risk to the child, court involvement is necessary. Court involvement does not always mean the children are removed. We also have cases where there's a risk to the children in the home and the family needs services, but the parents aren't following through on those services. So the court can order the parents to complete those services while also keeping the children in the home and safe. So those category 1 cases contain both of those: children who enter foster care and then children who are still in their family home, but the court is monitoring their service progress. Any questions about any of that? On page 19, it's just a brief overview of child protective hearings. So in case you come across a kiddo or a family who's in foster care, or their kids are in foster care, or a relative who's taking care of their, grandchildren or niece or nephew, and they're talking about the case, this is just kind of a brief outline for you to reference. I'm not going to go over all of them, but it just goes over all the different hearing types. On page 20, it just goes over the criminal child protective hearings. So child abuse, first degree, second degree, third degree, fourth degree, goes over those and what those mean. And then on page 21, it goes over the criminal sexual abuse of a child. So those are criminal sexual conduct in the first, second, third, and fourth degree. Just in case you hear those being thrown around or you have someone having those issues, it's just a reference for you to go to and see exactly what that means.
So remember, as a mandated reporter or a trained reporter, you encounter families in your daily work that you do, and some of those families can benefit from the support and encouragement that you can give them. Parent education is a powerful tool, and it really helps with prevention. If we can work with parents before they abuse a child or neglect a child and give them coping mechanisms, we can support them and the children. You can see on the back inside page of the manual that was handed out some of the services that the Family Support Center has available. And that includes parent education, working with families that are kinship families. Kinship families are other relatives taking care of children rather than the natural parents. We have this mandated reporter class. We have stewards of children, darkness to light, sexual abuse prevention training class. And as I indicated, we have the period of purple crying education that's available. We also distribute cribs free of charge to families that need a safe sleeping environment for infants and small children, and deliver diapers to 7 different partners in the community for them to hand out free to their participants in their programs. Any questions? We're done with the presentation, but we have time for questions.
No questions? I don't know that we've ever had no questions. Go ahead, Elaine.
Okay, so we recently had a reporting incident where a student disclosed to us that there was past physical abuse, that CPS was already involved. And then she said that particular weekend, her dad put his hands on her. So after today's training, I realized that probably wasn't a particular reporting case, just because we didn't know if it left a mark or anything. But would it have been okay to ask if it left a mark?
Yes.
And how long? Okay. All right.
Yep. That would be an appropriate question to ask. And I would say if you're unsure, then if you're unsure if it left a mark and maybe you're uncomfortable asking her that, but it sounded a little rough, that's an appropriate call to make too.
Okay.
Because I guess something, I don't know, we usually talk about this, but I don't know that we did. So within the state of Michigan, our system is like, I can see what happens up in Chippewa County. They can see what happens here. So we have all of that history from all the way back to the 90s. So
Okay.
if there's a pattern, and some parents, I've had cases where parents purposely pull a kid's hair because they know it's not going to leave a mark.
Okay.
That's not appropriate either. So those are still great cases for us to get involved with and talk to the family about that and help them decide other ways that they could help discipline their children other than that. So, and there is something we have called maltreatment, where it may be something that doesn't leave a mark, but it's excessive. So making the child consume hot sauce until they throw up,
Oh.
or, wall sits for 15 minutes, and the child is shaking and can't walk. Those are types of things that while they don't leave a mark, they can become excessive. And so while we don't always open on them, there are things we talk to parents about, and we help them decide other things they could do or give them pointers for other things they could do.
Awesome. Thank you for that.
You're welcome.
Well, if there's no other questions, I appreciate you attending the training, and Linda, thanks for setting it up.
Thank you for doing it. We really appreciate it.
Absolutely.
Not a
Anytime.
problem.
Everyone have a great weekend.
Thank you. You too.
Thank you.
Bye, everybody.
Bye.
Bye-bye.